Hey, I wanted to make kind of a quick rebuttal on here. The what's going around about doctors like myself actually getting bonuses from pharmaceutical companies in order to recommend vaccinations, and that somehow affects the recommendations that I make to kids is, first of all, as a human being, it's horribly insulting, but I understand that that's not necessarily the intent, and you don't know me or what's in my heart or what's in my head and what I've actually done, and honestly, you probably don't care. But let me tell you the truth of this and the good and the bad and the ugly. So back in the day, doctors got paid a amount that they charged you. So you would pay for your medical care. If you came in for an ear infection, there would be a specific charge and you had to pay for it. And then as insurance got in there, insurance was about risk and benefit, right? So I will insure you, but in order for me to keep things going, I need to have a certain amount of healthy people, a certain amount of people that have medical problems. I'm doing risk benefit and cost analysis. So when you pay your insurance company, they then reimburse us or pay us for the care that we have given on your behalf. So there's no money ever exchanged by pharmaceutical companies. That's actually illegal in the United States for very good reason. You can pay a doctor to speak on something, but they have to disclose that they do. You can give a doctor lunch if you're going to talk to them about a new product, but you cannot give them any money. And I think if you look me up, I think I've taken $44.73 over 20 years in meals. Where someone came in to talk about a new product, brought food, I have to sit there and listen to it, and that's how I get paid by a pharmaceutical company. How we actually are paid as doctors for giving vaccinations is one of two ways. There's a true fee-for-service model where I pay for the vaccination as a doctor, and then I charge your insurance company a little bit above what I paid for it in order to pay for my storage, to pay for how much I had to pay up front for it. So any interest, like on a loan that I had to take out to buy those vaccinations, because they're expensive. And then also an administrative fee, the syringes I have to use, the needles I have to use, anything I have to use to recuperate. We only get in those situations about 95% of our money back from vaccination. So a lot of practices kind of go in the hole a little bit to order vaccinations. And that's one of the problems with the fee-for-service model, is that a lot of insurance companies don't actually pay what the vaccines are worth. So we do our due diligence. We try to buy them in bulk. We try to shop around to different companies, try to say, how can we get these vaccinations as inexpensive as possible? If you're on a federal insurance, like Federal Blue Cross, if you're a federal employee, or Medicaid or TRICARE, you are under something called Vaccine for Children, which is where the federal government contracts to buy the vaccinations and gives them to primary care offices at a slightly decreased rate, but then we also get a decreased rate back for those. So that's how those work. So there's never any money that is like made by the primary care office by giving these vaccinations. They're just reimbursed for the things that they've already bought for. And this is any time you get your ears flushed or you get sutures. We actually are charging your insurance company for what we had to use because we have to buy those. If you get a splint put on in office or crutches, and we give you those. If you get a nebulizer in the office, we are billing your insurance company for those. Sometimes we get reimbursed, honestly, sometimes we don't. So that's how the fee-for-service model works. In the Medicaid world, or in where I am in Vermont, the state of Vermont has decided that they are going to provide all vaccinations to all children, regardless of their insurance, regardless of their ability to pay. So they pay for the vaccination. So I don't contract with any companies whatsoever. Vaccine for Children provides me with vaccinations, so I don't charge anybody for anything. The state charges the insurance companies and says, hey, you need to reimburse us for these vaccinations. We're not going to have any money change hand in a pediatrician's office. So what is the true part to these rumors? The true part is, in this kind of value-based healthcare, doctors like myself are reimbursed at a higher rate if we keep kids healthier. So if I am doing things like providing 24-hour call, and I have to prove all this, by the way, and it takes a lot of time and effort to do this. If I have weekend hours, if I decrease my ER admission rates, if I'm checking hemoglobin and lead in patients, if I'm screening for depression and anxiety, if I have good outcomes for kids, so kids are healthier in my practice, and I have meetings on a regular basis with these groups to prove that I am doing that, then I can get at close to 100% of what you pay your insurance company to pay me. So there's a stratification of that. So it's not bonuses. It is me getting the most of what I charge for those visits. And we're talking $175 for a well visit and the vaccinations. Like, this is not a ton of money in order to keep an office open, have highly skilled staff, pay for the time and effort and money. So that's why your doctors are always running behind and they have to book so many patients, because the amount that we can actually get paid by the insurance company is really low. So yeah, we want to jump through all these hoops, but we only have to get to like 80% vaccination rates, which is really easy to do in the United States so far. Because even today, as bad as the anti-vaccine movement is, at least 85% of the general public still believes vaccinations are the best thing to do for their family. So I don't even have to try hard to meet that standard. It has never been a standard that I've ever not met in 20 years, even in my practice where I don't discharge patients who don't vaccinate. And it's not each time, it's up to date by 2 and up to date by 12. However, the family wants to do it, however I want to do it. It's just about them being up to date, because here's the thing. Insurance companies get more money if you don't cost them money. So they will pay me a higher rate if you are more well. So while I don't agree with a lot of this, I wish we just had universal healthcare. I think healthcare should just be a right. I don't know how to make that work. Don't get me wrong. But I'm not being bonused, which is affecting how I provide care to people. Again, I know you don't know me, but I hope you can tell in the way that I talk. There is no way in God's green earth that I'm going to go to work and leave my family every single day and tell 20 families a lie that is harming their kids. Like, I could not live with that. I could not live with that. I've given over 37,000 vaccinations. I've been doing this over 20 years, and I have watched kids get healthier and healthier when it comes to these infections. I'm just as concerned about the chronic illness epidemic. Absolutely, I'm just as concerned, and I wish we were actually addressing it. But we have so many studies in the United States and even outside of the United States to say that they don't think there's a correlation between the two. And these are population studies. They're not sponsored by pharmaceutical companies. They were really good studies with millions of people in them. Are there more questions to be asked? Absolutely. There's always more questions. That's what that ACIP meeting was for. We used to always look forward to the ACIP meeting because they would change guidelines based on what the risk and benefit was. So we really relied on it as a way to stay up to date as providers of childhood care. So again, this will probably fall on deaf ears, but I think the more of us that say this and say this in a human way that's not demeaning, it's not being snarky, it's really just kind of saying, hey, what is it really like? How much do I really make? I'm the lowest paid medical specialty. And I do that taking out the same amount of loans as everybody else. I just paid off my loans and I'm almost 50 years old. I don't come from money. I paid for all of this myself and I would do it again. Do I make a good living? Yes, I do. And I give back as much as I possibly can. And I think doctors should be paid more than they are. All healthcare providers. I think teachers should be paid more than they are. I think all of you should be paid more than you are. That doesn't mean that I would ever allow it to affect my judgment on what I recommended for your family. I know that's not everybody out there, and I'm sorry for the negative experience that patients have had, but the reason a lot of us are on here is not because we get anything back for this. I've turned down 5 brand deals, and I only have 6,000 followers of people trying to pay me to sell you stuff. I will not do it. I will never do it. I am on here for education. If there's ever a dime I make off of social media, it's going to have to just be from views, which I'm never going to get there in this world. So I hope this helps a little bit. Ask me some questions. I hope you'll follow along, and I'll try to make some more videos about each individual vaccine. Take care.